So how does the high value visit involve the entire care team? First, the care navigator or the medical assistant needs to connect to the patient to ensure that they're coming in for the appointment and to be sure that they know what conditions the patient would like to address at that appointment. The medical assistant can pre-populate the orders and also outline what care needs need to be addressed at that visit so that the clinician is reminded when they see the patient what is due for that patient's visit. The team nurse can also prepare any vaccinations that are needed in advance once the patient arrives. And also the care management nurse can also be involved if they're taking care of a high-risk patient to preview what needs to be taken care of and also pre-populate orders for the subsequent visit that is being scheduled. The clinician also needs to be prepared for that visit. Part of the plan is to develop a care plan for each of their chronic conditions, and this can be done in preparation for the visit, even prior to the patient's arrival, and then modified once an agreement is made with the patient on what the care plan is going to be for a specific condition. So again, what is the role of the clinician? It is primarily to build trust, build trust, build trust. It is important to develop an agenda with the patient based on their concerns and also based on the concerns that we would have as care teams for what their chronic conditions and care gaps may be. A focused exam should be performed based on the active problems. The problem list should be then updated to make sure that it is up to date with the current conditions the patient has and that they're accurate, and then really encouraging compliance with the patient for the screening tests that need to be done. At this visit, orders will be completed for needed labs, any imaging that needs to be done, such as mammograms or other screening tests that may be required based on their health risks. And then if they need a pap smear or other preventative service exams, they should have that done at the same time. When we think about these care plans too, we want to think about how to make them lean and outlined using bullet points that are highly readable and functional. This can be placed in an overview section of each problem within the problem list, which most electronic records have. These care plans can be modified as the year goes on based on the patient's encounters with the clinical team. Ideally, all members of the clinical team can have access to the care plan and make modifications based on the direction of either the clinician or the care management nurse managing the patient. The advantage of using the problem list to have the care plans outlined is that it does not require searching through notes to figure out what the current care plan is for a particular problem. All someone has to do is look at the problem list, identify the problem, and then see what the care plan is in the overview section of that problem. So this is the value of the high value visit, is to create an overall summary of what the patient needs, engages the patient with a longer visit. We typically use 30 to 40 minutes for our high value visits in order to make sure there's enough time for the clinician to address all the key issues that need to be addressed and set up a plan for those that are not fully addressed at that visit, but at least having a care plan in place to identify when their next visit should be made for follow-up.